breathe all the way out. Good. And we're going to come just slightly back there. That's good. Good. Very good. Okay. Mild deficit there. A little bit of misalignment there still. Hold this here. I want you to squeeze your shoulder blades together. So kind of picture yourself squeezing. Very good. Yeah, a little bit on the left side. And I'm going to go on this side. It's a little bit better. Okay, do one final. So I do notice that that's gone down just a bit there. Hello, baby.
Hello.
I have you in for a new patient chiropractic assessment today. So it looks like we're having some concerns about headaches and neck pain as well as some shoulder pain.
Yeah, I sit a lot at a desk
Okay.
and also in the car, so.
Okay, so a lot of time sitting down.
Mhm.
So let's see. Maybe some roundness of the shoulders already noticeable. I'm going to move your hair a little bit here just to have a better look at the neck area. Now, when we say neck pain, are we thinking like more on the sides? Is it more towards the back, like on the spine? So if I palpate here, is it like
Yeah,
this?
directly in the back.
Directly in the back. Okay, so have a bit of a look at that. And then as far as the shoulder pain, would you say it's like front, kind of top of the shoulder area, or more like scapular in the back here, kind of by the bone?
Maybe more scapular.
More scapular. Okay. And that's on both sides?
Yeah.
So it's not isolated to one side or the other.
Right.
Okay. Any pain with movement? So like bending over or stretching your arms, does that make it worse at all?
Not too bad.
It doesn't make it any worse if you turn your head or look up and down. Okay.
Mm-mm.
So we'll do some mobility testing and I'll kind of move you around a little bit and you can let me know if any of that gets worse. And then I'll be doing some palpatory assessments, which just means I'll be feeling around with my hands and trying to assess if there are any nodules or if you have any knots. So essentially we're trying to see if this is just a general tightness that needs correcting, if we can make some modifications to your natural posture, or if there's something wrong and we're looking at more of like a muscle strain.
Okay.
So as I'm doing my visual assessment, I'm just going to ask you a couple of questions. So I'm just going to move your hair here for a second so I can have a look at the side of your neck. So I'm going to have you turn your head for me just a little bit there. Does that cause you any pain?
No.
Okay. Can you tell me about how many hours a day you would say you spend sitting down? So whether that's at a desk or on the couch, in the car, like cumulative hours per waking hours that you would say you're sitting.
I'd probably say like 6 hours. I do have a standing desk, so I try to
So alternate.
but I do spend at least 2 hours in the car.
Every day.
Yeah.
Okay. All right. And do you drive like a smaller compact car or a larger car?
Yeah, smaller.
Just asking because the seats tend to be different versus if you drive like a truck or something a little bit larger. So I do notice just a little bit of distension at the shoulder here. So I'm going to have you turn your head this opposite direction. Does that cause you any pain? No. Okay. Just going to come behind you here as well. So you say you have a standing desk and you try to alternate sitting versus standing, so that's very good. Now I assume while you're at the desk you're looking at some sort of screen?
Yes.
Okay. Do you have a laptop or like a desktop computer?
It's like monitors.
It's a monitor?
2 monitors.
Okay. And if you can show me, just by kind of using your hands, about where the screen is in comparison to your eyes. So are you looking down? Are you looking up?
It's pretty like
So it's pretty
in front of
parallel,
me,
so
yeah.
in front of you. Okay, so
But-
not necessarily neck down.
right. When I'm on my phone though,
Okay.
it's probably neck down.
And are you using your phone pretty often?
Yeah.
Okay. So that gives me a little bit of kind of a general idea of what we could be looking at. So this is a very common problem in this day and age as we're kind of using technology more and more. So just going to have a look here. So you can go ahead and relax for a minute. I want you to just kind of sit in your natural posture. So I'm going to come in with my Penlight. I'm going to just kind of have a look around at the overall anatomy and do a bit of an initial assessment. So just keep your eyes closed for me, and I want to shine my light in your eye. I'm actually going to start up at the head because you said you were having some headaches as well. So I'm going to look for any signs of inflammation. Sometimes headaches could be due to swelling. It could be that you're needing an adjustment. So just going to have a look at some of the areas that tend to be more problematic. So oftentimes along the temporal region we can have some sensitivity. Is that tender at all as I push down here?
Not right now.
And then as I come down behind the ear, I'm just going to turn your head slightly here. Do you have any tenderness here?
No.
No. Okay. So nothing really kind of lateral on the neck, which is a good sign. So I'm just going to have a look here just to make sure. So I like to look over the clavicle because sometimes signs of inflammation could be causing the pain. So just palpate here along the clavicular line. You haven't had any illnesses recently, like any cold or flu or anything that would cause any inflammation?
A couple weeks ago, I had a little cold.
Okay.
Yeah.
Do you typically have issues with like your sinuses or mucus production?
Some allergies, yeah.
Okay. So I just like to rule out any possible underlying effects that could be causing it. So I do actually feel just a little bit of distension here at the shoulder. I'm just going to move the strap of your top if that's okay. I just want to see. So just some very slight bulging here. So I will do some bilateral comparison and make sure there's nothing different from one side to the other. It could just be your anatomy, so that's okay. So I'm going to do the same thing on the other side. Right. So just going to move your hair here. Okay. Turn your head towards me just a little bit here. I'm just going to have a look on this side. Again, I don't notice any inflammation at the temporal region, any pain or tenderness there, BB?
No.
And as I come down the side of your ear, any pain or tenderness here?
No.
Good. So you just appear to have more prominent shoulder bones here because I notice it's pretty bilaterally distended, so that doesn't strike me as particularly concerning. Alright. We will have a better look at your back in just a minute. So, let's see. Just kind of having a look at the overall alignment of the neck. Gonna feel me do just some kind of swiping motion. Just feeling. Just a little bit of passive adjustment. I'm just kind of feeling if there's anything that looks just a little bit of distension here. I feel. So I'm gonna come up at the forehead here. Maybe a little bit of a nickel I might need it there as well. Maybe do some activation here. So I'm kind of feeling around to see when I bring my tools in where it's most needed. I do feel that there's a little bit of misalignment here. It's about 2 inches down there. I'm just going to feel around for any temperature variation. So just feeling if there's any areas that are particularly warm. Definitely feel just a little bit here. Just doing a superficial palpation of your lymph nodes. Since you did say that you were sick recently, I just want to rule out any underlying signs of infection and make sure that you don't need to be referred to like a general practitioner or anything, but that does feel okay. So I'm going to bring my hands up into the scalp. Any tenderness as I kind of move down here? No. So it really is just kind of isolated here to that lower neck. And then nothing up at the top of the scalp. None of this causes you any pain?
No.
Alright. You do have quite a bit of hair, excuse me. So the reason I mention that is sometimes the weight of our hair can cause excess tension on the neck. So just something for me to note. Okay. So now I'm going to do some measuring. I'll measure initially before I perform any postural adjustments. So I want you to sit very naturally in your normal position, so kind of how you would typically sit at your desk. I'm just going to use your earlobe as a marker here, measure laterally towards the jaw. Actually, you have decent angular so I'm going to come down. I do see some mild curvature there. So there's a bit of a roundness at the shoulder. It's just, again, kind of in line with what you said about the sitting. So a little bit more prominent there. Come right parallel to your chin and then measure kind of at the chest wall. That actually looks good there. Okay. Do the same thing on that other side. Excuse me. Alright. So again, I'm just going to measure the ear. Are you left-handed or right-handed, baby?
Right.
The reason I ask is because I do notice a bit of a difference from the left side and the right side. So, actually notice that your right side is just a little bit worse. Which, given that you are right-handed, makes sense because we tend to use the full dominant side of our body, not just our hand and arm. So I'm just going to come in here at the clavicle, just centered at the chest wall. Clearly symmetric there, that's not bad. Alright. So the secondary ruler here, and this one's going to allow me to be a bit more precise. At the shoulder. About 84 degrees on that right side. About 54 there, so that's okay. So about 4 degrees off here. And does confirm there's definitely a difference from your left and your right side. Let's see, 10 and a half there. And about 6. That's actually not too bad. Okay. Alright. Let's see, there are a couple things I want to do. I'm going to do some movement first. So I'm going to use my angled ruler this time. And I'm going to have you actually perform a couple of basic movements for me, and then I'm going to measure the curvature based on where we are at the time. Okay? So kind of starting with our head midline just like you are, I want you to turn your head as far as you can to the right side, and we're going to keep your shoulders in place. So don't overextend, but is that about as far as you can go? Measure from the shoulder to here. It's actually not too bad. Okay, while you're in this position, I want you to bring your head back as far as you can. Okay. Mild deficit there. Go ahead and bring your chin all the way to your chest. So you're going to keep coming forward. There you go. Perfect. That actually looks a little bit tight as well. Okay, alright. So I'm going to go back to the middle. So I do see some tightening here. Do you feel any tension here?
Yeah, a little.
Okay. So it looks like your muscles are just a bit tight. You're not able to fully flex and extend. I'm just going to palpate here. I'm going to do some mild activation. Just have this tool here. You're going to feel a light kind of suction and then a push. Is that too intense for you?
No.
So it's going to give us some light activation of the muscle. We're just kind of waking up the area and letting it know that we're going to be doing some manipulation here. So just very light activation of this muscle. Definitely have some underlying tension here. A little bit better already. Do you do any physical activity throughout the week? So any formal exercises or walking, Pilates, anything like that?
Yeah, I lift weights 4 times a week, or 3 to 4 times. And I also dance.
Okay. Do you ever find that you notice any difference in your mobility, or are you sometimes tighter than others?
I think it helps get movement to it when I'm sitting a lot.
You feel like the exercise actually helps?
Yeah.
Okay. So that's a good thing, just making sure that...
But maybe more like stretching.
Okay. So stretching is definitely a good idea. I'm just using these silicone tips to kind of get a little bit deeper in that muscle line.
Mm-hmm.
Stretching is definitely always a good idea when we're talking about kind of the upper body. If we're doing internal, external rotation, make sure you're getting some stretching of the scapula. You can use a stretching band if that helps. There are assistive devices that will help a little bit with your mobility. Do notice a little bit more tightness right there. Okay. have you just kind of allow me to move you, okay?
Okay.
So this is called the Alexander technique, and what I'm going to do is just kind of move your body, and I want you to be just a little bit on the flaccid side, so just kind of loose, and you're just going to allow me to move you. Any of the positions I move you in, if it causes you any discomfort, definitely let me know.
Okay.
So if we're starting for your natural position here, I'm going to move our head. Have you keep your chin down, and then I want you to picture your chest and your back kind of nailed down. So we're not going to move this portion of our body, and we're not going to really move our chin up and down. I want you to kind of go back at the neck. There we go. That's better. So that might feel unnatural because you're not used to sitting in that position. So that's kind of what we're correcting here. And then we're going to go more squared at the shoulder. I want you to breathe all the way in through your belly. And then breathe all the way out. Much better. Very good. So it definitely looks better at the back of the scapula. Okay. So I can see here, this is probably where you're feeling a lot of that pain and kind of tightness. Okay. Alright, so I think I'm going to have a bit of a closer look kind of at the shoulder area because I am seeing some of that distension there. I'm just going to keep with my adjustments for now. So I'm going to have you square at the elbows. So if I come around here. So I'm just going to have another look at the front here. I still am noticing just a little bit of forward movement at the neck. So we're going to come even further back up the shoulder. Do you feel any pulling here?
Also,
Feel okay?
yeah.
So come back and feel at the head. I want to feel if that made any difference. A little bit of relief. Still some warmth there though. Okay, I'm going to do some percussion here. So I have a reflex hammer, and I'm just going to kind of gently tap along certain areas. So let me know if this causes you any pain. Just feel a little spot of inflammation there. Okay. Maybe one more here, so about 4 inches. Definitely another one there. Okay. feel this device is going to get slightly warm. It's not enough to burn the skin, it's just going to kind of activate these muscles before we do some manipulation. So I want you to turn your head just enough to extend, not enough to cause you any strain. Does that feel okay? And we're going to turn slightly forward. Let me know if that's too hot. We're going to kind of gently kind of waking up the muscles. I'm going to do a little bit of manipulation, and this allows less jolting, less painful. Like one spot here that definitely needs. Just do that one more time. Just gonna go down. So we have about 3 different spots here that are needing to be adjusted. I feel actually a 4th one here. I'm gonna hold your head here, so I'm just gonna use my hand as a support. I want you to just allow your neck to relax. Come in and do some kind of micro adjusting here. So that first spot, it's about right there. A little bit of release there. Calm down. Definitely right here. Third spot is about here. This one actually is quite tight. I can feel the tension here. I am going to hold here. Let's do a bit of percussive therapy there. So you probably feel some mild vibration. Deactivating some of that tension. It's going to allow for a bit of release. You start to feel loosening up just a little bit at the shoulder. Do some scapular work as well, but so I'm going to come down here. A little more intense. Definitely getting more of a reaction here. Okay. I'm just going to hold here for a second. Left side, I do see markers of inflammation here. I wouldn't say it's quite as intense as the other side. So I'm going to go in with the same tool we used a second ago. Introducing heat and muscle activation here. See if we can loosen that up just a little bit. Good. I'm actually going to come forward because I notice a little bit of that rounding here at the left side. So come forward towards the clavicle. And maybe even a little bit down here at the deltoid. Let's do that one more time, and then I'm going to do some more of that kind of micro adjusting. I actually do feel a spot here. So we can start. So on the right side, I notice more tightness and inflammation at the neck versus on the left side. I do notice some scapular inflammation and kind of distension that we will address, but it's not quite as prominent on the left side of the neck as it is the left side of the shoulder. So just doing some mild adjusting here. And then there was one spot. Let's see. Right about there. Okay. Just gonna come in here. See if I can see any of that mobility. So I do see a little bit there. Again, going to feel some of that vibration. Very good. So I definitely feel, yeah, okay. So you might even feel the difference in intensity here. It's just a little more tight at the shoulder, and then you can hear that as well. A little bit better there. Do one activation here on the left side. It's a little better. And I'll go ahead and do one here. That's better. Okay, all right. So, come back in and just have a look. Not quite as distended at the neck, so that already looks a little bit better. Better alignment here as well. Is there any mild release of tension at the lower neck? Does it feel even just a little bit better?
Yeah, it does.
Once we know we're moving in the right direction. So I do want to have a better look at the cervical spine. I also want to do some palpating of the scapular indentation. I felt some distension there as well. And then I want to do some posture adjusting on the other side of things. So I'm going to have you turn around and then we'll have a bit of a look at that. Okay? Yeah. All right, baby. So I am coming back in and we're going to have a look at kind of the back of things. I'm going to do some more posture adjustment, kind of passive adjustment here, and then I'm going to have a look. So I'll start with the visual inspection just as I did on the other side. So again, just sit in kind of a relaxed position. Just going to pull your necklace forward if that's okay. So again, there's definitely a little bit of distension there. Does that feel tender at all?
Not too bad.
Not too bad. Any difference on this side?
A little more on this.
A little more on that side. Okay. Alright, I'm going to shine my light down here. Just want to see. There's a little bit of asymmetry actually. I see more so on the right side. And then as we come down, narrows out a little bit there. And then if we come up, again, a little more on the right side. You're going to feel that same little kind of silicone tool here. Just going to look. Maybe a little bit there. Mild distension there as well. So actually I do notice some of that inflammation here, but it is more prominent on the right side. Just going to feel a gentle pinching. A little bit swollen there. Not quite as palpable on the left side. Okay. So definitely going to do some activation there. So let's do some of those postural adjustments. Let me move your hair. Set it off to the side there. Okay, so I do also notice a little bit of bleeding, mildly asymmetric there. So again, you're going to allow me to just move you, okay? So I'm going to go ahead and perform some more of those kind of passive movements. I want you to just allow me to manipulate and kind of move around as needed, okay? So you just relax for me, nice and loose. Just going to first kind of feel around. Kind of feel some more of those swiping motions, just feeling for what needs to be altered. I feel a little bit there, so we're going to come back. And then maybe back here. Just come lower and have a look here. That's a lot better, a lot more aligned. Okay, I'll just adjust these up so I can see the outer shoulder better. So I'm going to feel directly along the spine. And feel a little bit of inflammation there. Just go there. A little bit of activation here. Let me know if that's too intense. kind of going directly on and around the area. Kind of do a little bit more. A little bit of that vibration here. Actually come down. Much better. Just kind of working in all directions allows me to loosen as much as possible. Directly along the spine, it might tickle just a little bit. And then we're going to do just a few more intense. It's not as noticeable on that left side. Misalignment there still. I'll hold this here. I want you to squeeze your shoulder blades together. So kind of picture yourself squeezing. Very good. Yeah, a little bit on the left side. Okay, go ahead and relax for me. So I'm going to come here and we're going to go and down. Very good. Gonna go in and then breathe all the way out. Good. And we're gonna come just slightly back there. That's good. Good. Very good. Okay. A little bit better there. Can you tell me when I come down here, where is the worst of that shoulder pain? So if I start here, is it worse as we come down? Is it worse up at the top?
Or the top.
At the top, so kind of here.
Like right there.
Right there. Okay. Is it the same on both sides?
A little more on the right.
And I'm going to guess that we could say the most tender area is probably about right there. I do a little bit more of an active adjustment here, so you're going to feel kind of like a jolt. It's not going to hurt, but just a little more intense than our other treatments. So I'm going to go on this side. One final. So I do notice that that's gone down just a bit there. baby. I'm gonna have you turn back around and we'll kind of discuss what I think we need to do moving forward, okay?
Okay.
Overall, would you say you're feeling a little bit better? Is it about the same?
Better,
A little
yeah.
bit better.
Yeah.
All right. So I do want to have you come back in. Not quite sure of my patient availability at this moment. So what I'm going to do is have you go ahead and go home, and then I will follow up in your patient portal. I'll kind of send some availability out, and then we can get you scheduled for that more active adjustment.
Great.
Okay?
Thank you.
Do you have any questions for me for today? Okay. All right. I will let you go for today, baby, and then I look forward to having you back in, and we'll kind of get you feeling better a little at a time. Thank you so much.
Thank you.